Hi guys, good morning, good afternoon, good day wherever you are watching me from. It's your girl again, Fumi Speech. Welcome to my channel. Today I'm going to be continuing the video just to buttress more on the points that I've started in one of the last video I shared about possible behaviors that you can notice in special needs children. So this video is just a continuation of my last video about some behaviors that you're going to be seeing whenever you come across special needs children. So stay tuned. And for my new subscriber, or you just stumbled on this video, my name is Fumilola, also known as Fumi Speech. I'm a special education needs therapist and I work with special needs children. If you have a special needs child, or you have seen a special needs child before and you love what I'm doing, you might want to stay tuned to this channel because I'm going to be sharing exciting tips and insightful knowledge on how you can go about your special needs child and how you can also cater for them. Another category we can also categorize attention deficit can be not following through instructions and failing to finish schoolwork. So, for instance, if a child is having difficulty understanding or following through an instruction, a typical child will be able to follow through an instruction given, no matter how many words or how many sentences has been spoken. But a special needs child cannot assimilate or cannot be able to follow through a given instruction. So when you give an instruction to a typical child, the typical child will be able to do it. Okay, Jesse, go to your room, clean your room, and after that you go to the bathroom, you go brush your teeth, you have your bath, and then go to the kitchen to prepare your breakfast. Now, this instruction cannot be given to a special needs child because the last sentence or the last word that you speak is what the child of special needs will pick. So let's say, for instance, you say, okay, Jesse, go to your room, tidy up your room. And mind you, tidy up, it's a vague or it's very elaborate. It's a big word for a special needs child. So you want to use like, okay, Jesse, go to your room and clean your room, bring the cloth, take the bed sheets and put it on the table. Now you're speaking and you're demonstrating. You're using the gestures to demonstrate. And after that, go to the bathroom to brush your teeth. And after that, you go to the kitchen to prepare your food. Now, the last thing is what the child of the special needs will do. Prepare your food. That is what the child will do. The child will go straight to the kitchen and get his food to eat. Because that's the last thing. They had processing difficulty. They cannot follow through instructions. So what you want to do with a special needs child in this scenario is to give the instruction one at a time. At a time the child finishes the first activity, you give the second instruction. Okay, Jesse, go to your room. You make sure that the child is going to the room. Okay, Jesse, take the bed sheet. You make sure that the child has taken the bed sheet. Okay, Jesse, put the bed sheet and let's spread. Now, the child cannot do the spreading. You just have to assist. Okay, after that, then Jesse, go to the bathroom. If the child does not know bathroom, toilet, go to the toilet. Of course, the child will know toilet. And if the child is unable to know toilet, you show the toilet picture. And then after that, show the child the toothbrush. You have to brush your teeth. And then after completing the brushing activity, then you say, oh, go to the kitchen and let's go and make breakfast. So breakfast also can be a vague word because what is breakfast? We know what breakfast is. But they might not know what breakfast is. So you say, okay, let's go to the kitchen and let's make food. Yummy, yummy food, and let's eat. So these are things that you want to break down your language because they have difficulty assimilating or following through instruction. And also chores, I've just mentioned it, tidying up the room and all that. Cleaning up would be a better word to use. And also they have difficulty, child with attention difficulty, they have difficulty organizing tasks. You see a special needs child learning corner might be in a disarray, it might not be that clean, it might not be that set, it might not be organized, but you know they require special attention to be able to organize their work area. They cannot organize their task. For instance, maybe their books, their academic books, they need to arrange it, and they need to know where their pencil case is. They need to know where their erasers are, where their sharpeners are, and all that. Their work materials, they have a kind of a specific place that is being designated for that particular special need. So once the thing is moved away from there, then there will be a problem. So these are what we call OCD. I think I've talked about this in my last video, OCD. So if you have not watched that video, you can refer back to that video where I talked about OCD. OCD means obsessive compulsive disorder. They are obsessed when something is moved away from where they originally were before. They get obsessed and they get they cry. Let me use that word. They just cry and see that those things are not arranged the way it was, or the way they find it to be. Another challenge for attention deficit hyperactivity could be losing things unnecessarily. When things that are needed to do an activity cannot be found, they lose things easily, they forget things easily, they don't remember where they kept their things. So for instance, they come home, they lose either their bag, or they lose one pair of socks, or they lose their pencil case, or they cannot remember anything, or they lose their bag. And sometimes maybe they can't find their way home. Yes, we have cases like that, that people or parents will be, you know, looking for their child. If it's a typical child, the child knows the way to his or her house that is maybe not too far of a distance, but a special needs child cannot even recognize where he or she is. So this is where a special needs child needs an attention, or needs a specialist as a guide. And another thing, another challenge for the attention deficit could be being easily distracted. This I have to emphasize more, easily distracted. Now, in our days when we're growing up, sometimes we lose interest in the topic because maybe the style to which the teacher is teaching. I mean, it is normal. We don't just like the topic, we don't just like the subject, so we lose interest. But for special needs children, it's not like that. They are easily distracted, even to the extreme of being in their own world and doing their own thing in their own space. They are easily distracted. So things around their environment, like for instance, if they are easily distracted by stimuli around them. So stimuli are things that surround our environment. So for instance, if the teacher is teaching in the classroom and then the lights, take for instance, the light is just blinking. That's number one distractor for a special needs child. So a special needs child wants to come to a classroom that is, you know, that is set and no much distraction, because whatever you're going to teach, the child is not just going to listen. The child is not just going to pay attention, because there are already distractors in the classroom. So you want to make sure that the lights are okay, they are the appropriate lightings for your classroom, and also the windows are not left open, or the louvers are not left open, whereby the child will be peeping and be looking and be distracted. Or maybe there's a football match going on, and then they are shouting, and then you're teaching in the classroom. The child with special needs cannot assimilate, because there are other things distracting. Everything is going into the brain and is already jumbling the brain of the special needs child, and is like, what do I take? Is it the teacher teaching in the front, or the football match going downstairs going on? So you want to make sure that the environment where the special needs child is learning is conducive, is less of distraction. So the last thing I'm going to talk about is a special needs child in terms of attention deficit is their easily forgetful. They forget things easily. They cannot remember. So when you have a typical child come back from school and then you ask the child, oh, tell me about school today. What happened in school? Tell me. The child is able to express him or herself and say, oh, a teacher taught us this. We did this one. We were able to do this. And then a teacher said we should bring something to school tomorrow, or tomorrow is dance day, tomorrow is party day. A special needs child will not be able to relate. A special needs child will just, oh, what did you as parents, we want to get feedback from our kids. We want to get feedback from our children, what they did in school. But a special needs child will not be able to relate. You will just be left aloof. Oh, okay, I understand, So they cannot relay activities done in school, and they forget. So you teach a child 1 + 1 today, or you teach a child how to fix a particular toy, and then tomorrow bring that same toy to the child will not be able to do it. It will take continuous practice and continuous dedication for the child to be able to do it continuously. And you don't say, oh, I taught you this yesterday, you should be able to know it. No, that doesn't work with special needs children. We have to be very patient with them. Remember, they are special needs, so we need to treat them in a special way. So with this, I'm going to stop here right now, and I hope you have been able to learn 1 or 2 things, and I believe that you're going to share this video to your loved ones, and you're going to consider subscribing if you have not done so. Please subscribe to my channel. Please help your little girl and to grow her channel, and also share the video to your loved ones, to those that you feel that can benefit from this video, or you've been citing a special needs child and you have been wondering, or you have been thinking, this child is behaving this way. Just encourage them to go for an assessment or a diagnosis, so they can be able to care for the child properly. Early intervention is the key. Remember, when they have them early and we tackle them at the younger age, then they can be able to mingle with their peers or their age mates and be able to function in their life, because delay can be dangerous. Thank you so much. I will see you in my next video. Bye.